Just for a little context, antimicrobial stewardship is really a process, kind of a bundle of interventions that's at the intersection of physicians, clinical pharmacists, and the medical laboratory. And really, where the clinical laboratory's role lies is looking at really several things. Some entities call these the 6 Ds of antimicrobial stewardship. And so it begins with diagnosis, the first D. That's really us providing guidance to clinicians and others in obtaining the adequate and correct specimen, as well as the identification of the actual organism, and even more critical, the correct and accurate use of the right antibiotic. The other one is, believe it or not, is something called debridement and drainage. So we really are consulted around when we need to obtain the correct specimens. I can't emphasize this enough, that the adequate and correct specimen at the bedside is critical for the microbiology and the medical laboratory to do their job correctly. We want to provide the accurate and correct information so that the right drug is utilized. So for instance, if we know we have a patient that has a respiratory infection and they're a certain age and they're a certain patient category and other factors, there's a predicted best drug. Along with that is the right dose. Again, this is where we're working really closely with pharmacy and the physician to make sure that we use the dose at the right level, the strength, and right with that is duration. Many antibiotics do not need to be used for 2 weeks, for example, and sometimes physicians will rely on old habits of prescribing and going from a book, from something they learned years ago. You know, we need 14 days for this drug because it's this infection. Whereas in reality, they may be able to stop using that drug in 4 days or 7 days. And so that's critical to stop resistance issues. And then de-escalation, right? So slowly reevaluating diagnosis and therapy on a routine basis so that we help physicians and pharmacists to use real-time data in their choice and selection of drugs. But it's not an easy answer. There are so many areas that the clinical laboratory needs to be involved with as it pertains to antimicrobial stewardship and resistance of drugs. Now, our biggest challenge is being consulted in all healthcare decisions. Medical laboratory scientists, clinical microbiologists provide most, if not all, of the data, the laboratory medical data that physicians and pharmacists need to create a healthcare plan. And so this is really our biggest challenge, is to have a seat at the table. We might talk about this more in a minute, but most hospitals now are advised by the Centers for Disease Control and other entities to have an antimicrobial stewardship program. This is sometimes referred to as an infection control committee. It could also be a laboratory utilization test committee. There's different names for it, but we absolutely need to be at that table providing this type of information and really almost a day-to-day consultation on these things. And so I can get into this a little bit more later, but having a seat at that table and understanding that from a clinical pharmacy and physician's perspective, that we need to be at that table to give them that information. That is an ongoing advancement in almost all medical areas. You know, in our field, in the medical laboratory field, probably the greatest advancement over the last 10 to 20 years, kind of depending on what area you're looking at, is the just major advancement in rapid point of care testing. In other words, tests that have been approved to test patients at the bedside, so that you get rapid answers, rapid data, which obviously helps influence real-time medical decisions, including the choice of an antibiotic. They're not perfect always, but they certainly have advanced. And so that is probably the single biggest way that data and analytics have influenced that, as well as the ongoing ability to provide research and understanding around, say, sets of data. So we look at things over a period of time, and we have trends and can provide information like an antibiogram, which is a way for physicians to look at syndrome. So let's say a patient comes in and they have a sepsis. And so depending on a number of factors, we used published data that a physician and others can use to predict the correct antibiotic or the correct antiviral or the correct antifungal, whatever drug they need, based on data and analytics. So that's way better than guesswork that we did, decades and decades ago. This is a huge issue, and it's an interesting double-edged sword, Chuck. So we have, on one hand, the pandemic, COVID-19, has absolutely shined a light of amazing visibility on the medical and clinical laboratory profession and our professionals. That's good, because often as some of my writing and other comments, I'll mention how we are often saving lives in the shadows of healthcare. Many people don't see us because we're not a first-line patient care provider like a pharmacist or a physician or a nurse. Even choosing this major for a college major, most people don't understand that they can go this route. They're thinking medical school or nursing school or physical therapy, and that's because they don't see us, right? So that's a wonderful thing. Kind of a weird benefit of this pandemic is that it has shone that light on us. The flip of that, of COVID-19 and the pandemic, is that as of last week, our profession and our professionals have provided over 400 million COVID tests in this country. It has absolutely swamped us. This is on top of all of the other ongoing issues around testing in the laboratory. So it's on top of the normal testing. Remember, people don't stop dying of heart attacks or needing cancer diagnosis or sickle cell anemia treatment or anything else. So we're involved in all medical laboratory testing. So it's overwhelmed our profession. And I think really the biggest impact that I would say that's kind of difficult is that we already had staffing issues. We have some serious shortage issues that basically equal nursing in other areas and physicians. Again, and people don't know this always because we're not out there in the front lines, but so staffing of our profession has reached an all-time critical issue with respect to providing quality patient health care. Yes, absolutely. I mean, as you know, and maybe some of your audience knows, this is an area that I've worked in really for the past, at least 5 to 7 years, is trying to bring that light, that recognition of the medical laboratory as a critical component of patient quality and healthcare overall. So that visibility issue with respect to antimicrobial resistance is absolutely necessary, because ultimately you cannot move forward accurately without a confirmatory laboratory test and a way to know which antibiotic or other drug to utilize if it's a viral infection, for example, without a test. You can do it empirically, and certainly sometimes we have to do that in an emergency situation, but ultimately you need a culture and a susceptibility test, which the medical laboratory provides. And we need, again, to be at that table to do that. We are experts in this area. If you look across the spectrum of laboratory medicine education and training, we receive a full degree in that. We have multiple degree levels, including the doctorate in clinical laboratory science now, and thousands of hours of education and training in this area. Medical schools may only get a course or two in this, very limited. And so doctors, nurses, pharmacists are amazing. We absolutely need that collaborative effort, but they need our expertise. They really need our expertise. We need to be in that consultation effort with diagnostic management teams, where we're rounding with them. We're helping them pick the right test. We're helping them to interpret those tests and to really help create the best patient care in that manner. not only the area of just doing the laboratory work and merging that data with those other areas of the team effort for patient treatment, but also ongoing education. So I really think our role can be one of education. Sometimes I like to refer to our profession as the ability to raise laboratory medicine literacy among other healthcare professionals. Again, that's not taking anything away from these other professions. They have a ton on their plate in direct patient care and decisions and other things that they do. But why wouldn't you want an expert in laboratory medicine to be there with you, right? It would be just like, my analogy is often looking at the airline industry, right? We know the vital role that pilots play, that flight attendants play, and others within the system, but you may not think about the mechanics, right? And those that are kind of behind the scenes. And you absolutely want that aircraft to be worked on by certified, licensed professional mechanics. That's us. We're behind the scenes. We're providing that information. We need to be there to foster that collaboration and to really use the right data with respect to decisions that are being made. And I continue to hope and pray that as our profession advances into more visibility, that we will be invited to those tables and other tables to help make those correct and accurate predictions for testing and interpretation.